founded Thai Bodywork in 2001 here in Evanston, which is a wonderful community just north of Chicago. And we found a great teaching facility here. Right now we're in the courtyard where students can relax and eat their lunch. We teach 2 to 4 courses, generally weekend intensives per month, beginning with the level 1 training. That's a entry point for everyone to get started and learn great fundamentals. Then people would move to the level 2 training or the level 3 training. They don't necessarily have to be done in order, focusing on the Southern method in level 2 and the Northern style in level 3. And then we have several different directions for advanced work, including 4, 5, 6, which cover the Ayurvedic and advanced poses, Panchakarma treatments, and so on. Very strong Ayurvedic influence in Thai massage. And also the commoner style, which is the walking style that emphasizes using the feet and the knees. And clinical Thai bodywork, which is a modality that I've developed out of my own personal practice for treating chronic pain and dysfunction. And we have approximately 80 hours available in clinical Thai bodywork course. From here I step, so I place my foot by the client's foot, kneel outside the hip. I'm going to use a lunge to transfer my body weight. We start with palm walking. I place my hand below the level of the greater trochanter and move into the knee. Watch the pressure, especially on the lateral upper leg here. This area, which is the vastus lateralis muscle, can be very tender on people, especially down by the knee. Very common trigger point area. Okay, stabilize yourself on the hip when you move. Move your foot so that it's parallel to the knee. That keeps the hip from collapsing. So I can press on the hip, and that keeps the knee from moving. This is again a butterfly position. Hands point apart. I make room for the greater trochanter, which is a bony part of the femur that emerges, so I don't want to press directly on that. Most of my weight is going to be on the hip hand as opposed to the upper leg. And just drop in, let your body weight compress those areas. Each time I press, I'm moving fluid out of those muscles and then it flushes back in. These are very important areas of the body. These muscles tend to refer pain to the lower back and all the way down the leg. And just press to 4 or 5 points. And with a little circle in both directions. Again, stabilize yourself on the hip. Now I'm going to turn around so that I'm facing backward, and the position is this leg is up, this knee is adjacent to the client. I reach across and get the foot, and I bring the leg into slight extension. And then you can control the position of extension with your foot. This is an excellent position to work the line of the leg that emerges from the TFL, tensor fasciae lata, which ties into the IT band on the side of the leg. Now if you feel there's a bony part of the hip, the ASIS, and then there's the greater trochanter. So we want to be in between those two muscles. And you can just place your arm in line with that trough between those two bony prominences. The hand stabilizes the knee, and I roll out. And then with forearm, palm down to palm up, I roll the lateral upper leg. We often use this position in Thai massage because my leg is stabilizing her leg, and then I can just use body weight. Now I have to select a leg. Again, my client being female, I will select the left leg. Move up a little bit, and you need to move the knee out so that it makes a comfortable curve for the hip. The foot arch of the foot should cross just above the knee. This hand keeps the foot above the knee, and with this hand I palm press to just bring my body weight over my straight arm and palm press this posterior lateral line of the upper leg from the hip down to the knee, and work that line 3 times. Keep your back straight, arms straight, just use body weight. With this hand, keep the foot where it is and fold this foot up. Now it's actually trapping her foot behind the knee, which is compressing the gastroc. It's also compressing the hamstring, and we're creating some decompression in the knee, so opening some joint space in the knee. And we do the same thing. We also keep a little bit of pressure on the foot, but not too much because that'll be uncomfortable behind the knee. Keep the foot where it is and move the arm up. I want to kneel near the lumbar, so just outside the low back. My other foot is below the client's knee. I hook my hand right behind the knee and keep the foot on the inside of my arm. This hand reaches across the spine, not on the bone of the spine, but across. So I press with my knee, straighten this leg. That's what does all the work. Pushes my body over so that I'm not lifting with my back. Move your hand up just a little bit. You still want to be basically off the ribs. And we do it a total of 3 times. This places the knee into extension, so it's both a quad stretch and a psoas stretch. From here, move down to the feet. Neutralize the legs so that they're both normal. And now I fold the other knee. Move the knee out, very important, so that the arch of the foot crosses over the leg. Stay kneeling. And palm press from the hip down to the knee. Work this line 3 times. So down, up, and down again. So the table application of this northern introductory sequence actually makes a very nice 1-hour Thai table massage. When we work on the table, there's some basic things that we do. One is putting your knee up on the table. This table's set a little lower than you might for Western massage. Having the knee on the table, being able to bring it up and down very easily is very helpful. You also want good working weight. So this table is about 800 pounds working weight. 600 to 800 pounds minimum is good. That way we know we can work safely. Very similar to working on the mat, except that you want to always take it out of your back, so you want a deep lunge when you're doing the palming work. Initially you can use a lunge for the warm-up, and then as you move up the body, as you move to the knees, bring your knee up. I can still use my body weight, and then if I have to, I can still come totally up onto the table. This can all be draped as well. We're not showing that in this case, but it is possible to drape the client safely for all this work. Bring your leg up onto next to the client. Hold knee and ankle. Trap the ankle with your hand on your leg. This controls the stretch here. And then very easy to use the rolling elbow technique in the hip, and forearm roll, palm down to palm up. And to stretch, we just move back. Now for the folded leg routine. This leg up on the mat, on the table. Keep your foot here, move up to the back. So your foot is positioned right by the client's knee. Place your hand in the low back and just push off with your foot to do the lift.